To document the patient's family history, click the Family History Template tool from within your chart note. Then click Add New Relationship from the bottom of the dialog. From within the Add New Relationship dialog, the only two fields that are required are the relationship and the disease or lack thereof. No known conditions will be checked by default whenever you add a new relationship. However, the system will automatically remove this designation once you click Add Disease and add something to their chart. Click the Relationship drop-down to select the relation. If you see an asterisk next to the relation, this indicates it is a first-degree relative, which was important for meaningful use purposes. Next, you have the chance to document additional information about this relative if you prefer to do so. You have the option to document their name, document their age, or if you type in their date of birth, the software will calculate it for you. If this relative is deceased, you can document their cause of death by clicking Select and searching the database for the appropriate cause. Likewise, you could also document their age of death and/or year of death. The checkbox for No Known Conditions would be used to document that this relative has no pertinent family history information. You would obviously only use that if you did not have a disease documented at the bottom of this screen. To document the family member's clinical history, click Add Disease. You will then be presented with a list of conditions to select from, or you can click Unknown Disease from the bottom of the list and then document the details in the comment field after you close this dialog. Or you can click Search to search the SNOMED database. If you see a plus sign next to a condition, you will need to click it in order to expand the list. Click OK after selecting a condition. At this point, you could add the age of onset or a comment by clicking in the respective columns and typing the information. If you need to modify the disease or condition, click Edit Disease. If you rather just remove it altogether, you can click Delete Disease. If this relative has more history to add, click Add Disease and follow the same steps we just took to select the condition. If you have another family member to document, you could click Add Another to open a new relationship dialog and save a few clicks at the same time. Otherwise, click OK when you are done documenting family history for this relative. You will then see the information you documented appear in the Family History dialog. If you need to modify this relative's information, click Edit Relationship Details from the bottom. If you want to remove this information from their chart, click Delete Relationship. If you need to add more family history, you can click Add New Relationship and follow the steps we just took. By default, Display in Note will be selected. However, if for some reason you do not want this information to appear in your current chart note, you could uncheck this box. Also by default, this information will print in your chart note in a paragraph format, but if you would like it to display in a list format, you could check the box to do so. Click OK when you are done adding family history. You will then see the information you just added appear in your chart note, on the face sheet, and in the History tab of the patient's chart. Please note, if you originally added family history in Clinical prior to version 5.1, the information will appear in the Family History dialog as Unstructured History. Ideally, you will want to right-click on this information and select Send to New Relationship or Add to Existing Relationship. After doing so, you would add the relative's information and click Edit Disease to convert the information to structured data.